If your child is born with unilateral cleft lip and palate, I would like to discuss with you all the procedures that are done in the first year of life. Normally, at the age of 3 to 4 months, we repair the lip, and this involves bringing tissues together of the lip, and this involves bringing the tissues of the lip together. At approximately 9 months of age, we usually repair the palate. Generally, those are the procedures that are done in the first year of life. So we start at the age of 3 months to do the repair of the lip, and then after that, at the age of 9 to 10 months, we repair the palate. And this almost takes the first year of life, and in between there is a period of time that needs no care for any procedure or operation. But usually we have a procedure that may be done, but it's not a surgical procedure. It's called naso-alveolar molding. And this naso-alveolar molding, which is called NAM, is done for cases that have a very wide gap in between the lips. So you can see here in the picture that this gap may be very large, and also the nasal molding is so flat. So we use the naso-alveolar molding usually by using the straps in order to make approximation of the two lips together and of the nasal ends together. After the palate repair, we usually see the children in our clinic for follow-up, and this is usually annually. And we follow up the multidisciplinary team approach. We generally reassess the lip and palate and reassess the need for any revision procedure for any of them. This is usually before the age of school at 5 to 6 years old. So we can see at 5 to 6 years age, we can pick up the children who have difficulties in speech and do revision of palate usually, and if there is any cosmetic unsatisfying outcome, we also make some revisions to the lip. And this is normally something that we pick it up at the age of 5 to 6 years during the children's annual visits. Several techniques are used in our lip repair, and usually 1 or 2 techniques are used in the cleft lip and the cleft palate repair, and usually 1 or 2 techniques are used in the cleft palate repair. The cleft lip, very popular repairs are usually Millard repair and Tennyson repair, and we prefer at our procedures to do Millard repair. Millard technique depends upon making the following triangles. There is a triangle like this. It usually is a curvilinear incision that leads to this flap to be rotated downwards. And this a triangle which is called advancement flap that moves forwards. And another one called clomellar flap relating to the clomella, which is this part. And this goes on the opposite of the advancement second flap. So when we design our flaps, we do something like that. And after this cut, this part moves downwards in order actually to elongate, to lengthen the lip. And there is a part that advances itself inside this part that is evacuated after the moving downward of this flap. And then closure of the nasal floor is done through the third flap, which moves like that. If you want to take this picture, we can see this. This is a design just preoperatively on the table. This is called the advancement flap, and this is called the rotational flap. And this is called the glomerular flap. The movement is like that. Take care. This moves like this, and this moves here, and this moves here. This is simply 3 flaps. One rotates downward, and one advancement flap rotates to the other side, and another one closes the nasal cell. This is usually not discussed with the parents, but it's discussed with our colleagues and every candidate that is a trainee in the Cleft Lip Prepare. Thanks, and we can see you at the Cleft Palate in another session.